If you've ever heard or ever been told that there's nothing that can be done for your neuropathy, printed out some research for you. So at the time of this recording, by the way, I'm Dr. Ryan K. Lewis, DC. I've been in private practice for 22 years, and at the time of this recording, I've been working with neuropathy for 18 of those 22 years. And the research I just printed was inspired by a phone call that we had earlier today in the clinic. Now, as you would imagine, we hear all the time people say, my doctor said there's nothing can be done. The neuro said there's not. I hear it on a regular basis. That's not, I'm not surprised by that, but it's unfortunate. So just sharing information. I just went to the computer, end of our day around here, and I'm gonna shoot this quick video for you. I'm gonna share some medical research that I just printed out. So this research is from 2023. And possibly newer, but the one I'm holding on top here, this medical study, is from 2023. Now there's a couple things that I want to unpack for you as quickly as possible that I think would be of benefit. Number one is, I think not all neuropathies can be helped. I'm not standing here telling you that. I'm not telling you your neuropathy can be helped. I don't take every case. I don't think there's a cure. I don't use the word reverse, all these things. But I do know some neuropathy, some nerve damage can heal. So in general, nerves have the ability to heal. This in particular is on a therapy, this research, as I'm citing, is on a therapy that we use in our Nerve Fit program for neuropathy and balance problems, okay? So this is on a therapy that we use. By the way, this is what's called a meta-analysis in a peer-reviewed medical journal. Meta-analysis, meta just means big, whole lot. So they used 8 different medical studies on this same therapy. The reason I like this one and it grabbed my attention is because not only did the patients in the study have reported that they had a better outcome, they also showed that the nerve conduction velocity. So if you ever had an NCV, if they ever poked your nerves with needles and shocked you and you said ouch, or they were measuring the feedback. So if you ever had an NCV or nerve conduction velocity study, the therapy showed improvement in neuropathic pain and nerve conduction velocity. That's why I like these studies. It was not only did the patients say they got better using this therapy or having this therapy done for them, they were able to prove it with the NCV. I thought that was great. Okay, so a couple notes here. So first one is, it's sad that I think that people are told that there's nothing to be done, and I don't think that the options are explored. Now, are there cases that is true? Of course. So I don't think your options have been explored. Most of the cases I meet have been told that, okay? The other thing is there are therapies that can actually help certain types of nerve damage. And the other part that they bring up in here is one of the complications would be ulcers. Ulcers can lead to amputation, and that's a scary, scary thing. So those are the couple things I wanted to unpack for you real fast. So the background is neuropathy is a severe complication in these trials of other underlying metabolic disease. The most common symptoms are neuropathic pain and altered sensorium due to damage to small nerve fibers. Altered plantar pressure distribution is also a major risk factor in peripheral neuropathy, leading to foot ulcers. The objective, the methods used, the results. This systemic review included 8 studies in which this therapy showed improvement in neuropathic pain and nerve conduction velocity, which I already read earlier. It also reduces plantar pressure distribution, which is a high risk for developing foot ulcers. Here's what that means. So this is a thing that no one tells you when you have neuropathy. So when you have nerve damage in the nerves in your feet, so think of it this way. So you see the back of my hand, because I'm not going to put my foot up here on camera. And you see these lines, so the lines are the tendons right here. And sometimes in your feet, especially when we were younger, you can see the tendons going across the top of the bones. Anyway, the point is, when you're losing the nerves that are in your muscles, tendons, and joints, you lose the integrity of those structures, meaning they start to lose shape. And that's why your toes are starting to draw up. And that's why your toes are starting to become crooked off to the side. It's not just because you wore pointy shoes or something along those lines. Although it can happen for that, that's arthritic change. But I'm talking about when you have deformity, the toes drawing up, the toes moving sideways. You need to be tested if you're not sure, because you end up putting pressure. So they call it altered plantar pressure distribution. Fancy what they say, you end up putting pressure on spots in your feet, your skin, your toes, the tops of your toes, rubbing on your shoes, and you start to get ulcers. And ulcers, if you have nerve damage, it's hard to have tissues heal, and you're at risk for amputation. Your infection leads to amputation. Okay, I'm not trying to worry you. It is worrisome, so I'm sharing this info with you. But I thought I would shoot this real quick and just let you know, like, there's this, the name of this main trial that I'm reading is Effectiveness of Therapy on Neuropathic Pain, Nerve Conduction, and Plantar Pressure Distribution in Neuropathy, a systemic review. So folks, the information's out there. My name is Dr. Ryan K. Lewis, DC, Missouri Pain Treatment Center. If you'd like to know more, give our office a call. That's 1-855-FIX-FEET. That's 1-855-FIX-FEET. Call our office. We'll give you information. You can get on our email list, get on our YouTube channel, subscribe. You'll get plenty of neuropathy information. Attend one of our seminars, whatever you need. We know at Missouri Pain Treatment Center, people that have neuropathy and balance problems, you're not getting the help that you need. We believe everyone deserves help so you can lead a more active and better life. Take care.